start.
Okay, this is Z, and I am presenting pathophysiology of eye and also the diseases of eye in adults or geriatric patients. So the diseases that I have selected to present in this presentation is cataract, glaucoma, and astigmatism. So astigmatism, glaucoma, and cataract are my diseases. And first I'm going to tell you guys or explain the structure of eye. So the structure of eye carries that I am gonna present are 11 parts. The first is sclera. So this is the diagram that I made. So this is an eyeball and this is a sclera, which is the outermost coat of eyeball, which protects the eyeball. And then it's the choroid, that is the vascular coat which nourishes the eye. The retina is also over here. That is the inner coat of the eyeball, contains rods and cones, converts the light into nerve impulse. Then there is a ciliary body over here in front. That is a muscular structure which holds the lens and helps for accommodation. It means in maintaining the intraocular pressure. That is very important to have the eyesight. Then it is iris that controls the pupil size and light entry into the eye. And then the lens, that is a crystalline and convex lens, focuses light into retina. Then there is cornea right here, that is transparent and important refractive surface of eye. Fovea is right over there. That is a small area in retina where cones are densely packed, helps for color vision. Then the anterior chamber here, that is a space between cornea and lens that contains aqueous humor. Vitreous chamber is the chamber that is between lens and retina, that it contains the vitreous humor. And also the optic nerve down here, that nerve carries impulse from eye to the visual cortex. So this is the thing that is holding the eye to the visual cortex. So this is the structure of an eye that I've discussed. And then the diseases of eye in adults are gonna be the cataract, glaucoma, and astigmatism. So first, what cataract is. So cataract is the clouding of the normally clear lens of the eye. Mostly the cataracts develop slowly over the course of years and towards after the 40 years of age, usually in adults. Like this is seen usually in adults. And a little about cataract can be like, it's like part is affected. The one part of the lens or the smaller part of the lens is affected or is become cloudy, which is so the person is having a hard time focus or see. It is like a blurry vision that gives. It is the opacification of lens results in gradual progressive loss of vision. So with the span of time, the person will stop like focusing and will stop looking clearly. The clinical features can be, as I say, glare, a little glare on the eyesight, a diplopia, colored halos around light. That's like, it can explain that how there are a rainbow colored light is between the around the object. Poor color discrimination, that people is not able to discriminate or distinguish between two colors that are look-alike. Floaters, blurring or misty vision, deterioration of vision. Diagnosis is by investigations like oblique illumination, examination, iris shadow test, slit lamp examination, and distance direct ophthalmoscopy. Then management and treatment can include the cause of cataract like diabetes, uveitis, etc. And it can only be treated by removal of the cataract-genic drugs and irradiation. So you have to go through a little surgery to remove it. And then there is a period of time where you have to relax and kind of like rest to come up with the some of the management prescribes that you cannot lift you cannot lift more than 10 pounds, or you cannot lift more than 7 pounds, because it's gonna give you the pressure on the intraocular pressure, which is not good. So the prescription of glasses for refractive status, the prescribed glasses is gonna be with you. And nursing management for cataract can be check visual acuity, teach patient about what cataract is, and then also teach patient about the healthy diet, which can help to heal them after the surgery, and also educate about medication compliance, and when and what and how the drops have to be given inside the eye, and when, what time. It doesn't have to be more than what is needed and not less than what is needed. So it has to be accurately given. The eye drops have to be accurately given into the eye on the accurate or prescribed timings. Then the next is the glaucoma. Glaucoma is the eye condition that can cause blindness if it is not treated. So the nerve connecting the eye into the brain is damaged. That's why usually done to high intraocular pressure. So the part affected, angle of anterior chamber characterized by raised intraocular pressure, optic nerve is damaged, and reduced visual field. Clinical features that it can be, how it can be diagnosed is a patient will feel the pain, redness, nauseated, also episodes of vomiting, blurring of vision, halos around light. And again, the diagnosis by investigations, like you can do the tonometry, and tonometry can diagnose the intraocular pressure that is raised, and also the oblique illumination, eclipse sign. Slit lamp examination can be also done to diagnose this condition, hazy and edematous cornea, iris atrophy, anterior capsular opacities. Treatment that it can be treated by reduced intraocular pressure by using drugs, that is mannitol, acetazolamide, or pilocarpine. So it can be treated by that. If it's not treated by the drops, so the surgical surgeries can be done, like laser iridotomy, prophylactic laser iridotomy for the other normal eye. Then the last one is astigmatism. Astigmatism can be is a refractive error, and it's actually a common imperfection in the eye's curvature. So the front surface of the eye or the lens inside the eye is curved differently in other direction than the other. So the treatment for the clinical features can be blurred vision, tends to keep materials close to eyes, headache, watering, and tiredness of eye. Head is tilt, half closure of lids. Diagnosis by retinoscopy, keratometry, astigmatic fan test, etc. The treatment can be cylindrical lens as spectacles or contact lenses, or you have to go through a surgery like a LASIK, limbo, relaxing incisions, etc. And the nursing management is patient education, provide education regarding the use of and effects of medication, provide support and interventions to aid the patient in adjusting to vision loss, potential vision loss. So the nursing management for all the three diseases can be the before the surgery, that the nurse should assess the history, recent medication intake of patient, pre-operative test, vital signs, visual acuity test, etc. And then after the surgery, the patient before discharge, the patient should be educated about self-care, like eye care, proper intake of medications, probable side effects, etc. Like the biggest take home pointer for the patient is like, do not take a shower, and then do not lift any heavy weight things to not put pressure on your eye. So yeah, that was my little talk about eyeball. Thank you.